Oh boy. Hold on a second here. It's got a weird
Sure.
pop-up.
You know, Penny, I am getting a message that the stream is live. So I don't know if you're,
I just got it. Yeah, for some reason it came up with Internet Explorer wasn't accepting it. So but we are live now.
all righty. Well, thanks, Penny. Good morning, everyone, and welcome. I'm Dave Roth. This is our fourth meeting of the Health Equity and Access Response Team. And I thank you all so much for your commitment to this. This fourth meeting has happened over a 7-week period. Your investment, your engagement in this process has been wonderful. And I'll talk in a minute about what we'll do today, but I want to remind you that up to this point in our 3 previous meetings, we've gotten a detailed look at the data regarding COVID-19 impact, and that's been disaggregated by race. We've had good discussion about that. What does that mean? What's missing? We've had a roundtable discussion about the impact in each one of our areas and looked at ideas for creating new, enhanced, or expanded programming so that we are working toward optimal health for all. A couple of weeks ago, we got educated about the status of vaccine, and we also got introduced to the abundance of communication tools that are available to us through the DuPage County Health Department. And in between these meetings, we've had work groups at work on mental health and communications. So we've come a long way in 7 weeks, and that's because of the investment that all of you have brought to this. So now about today, this is a Zoom meeting. We're being live streamed. We are building a team in that way that is both transparent, but also cohesive among ourselves. The meeting is being recorded so that even those who can't be here and the general public can stay engaged with us and can keep up. Today, please be aware of background noises. Please mute yourself when you're not talking. And during our discussion times, I encourage you to keep your video on as much as you're comfortable doing so that we are able to get to know each other better. Remember that we are the team that is leveraging our diversity to create new solutions so that no one in the entire community is disadvantaged as we respond to COVID-19, and that everyone's health reaches its optimal level. Today, we've got a full agenda, and it's going to include some things coming at you and a request for you to come back with discussion on some things. So we're going to welcome new members to the group who've not been with us before. We won't go through the entire group because our 90 minutes would get by too quickly then. We're going to get a very high level update on vaccine from the DuPage County Health Department. We're going to stimulate discussion and solutions identification for building vaccine confidence. Ultimately, the goal of those two things, that vaccine update and that conversation, is that you're going to be able to leave this meeting with specific ideas about what you can do as a leader in your community with your constituents to build vaccine confidence. We're also going to provide brief updates on other team activities that are going on and consider when we're going to gather again for our next meeting. So that's what we have in front of us today. First thing I want to do is ask those folks who've not been with us before to introduce yourselves. And we also have a couple of guests, Angela and Allison. I'm going to ask you to hold off on your introductions for a second because we'll get you introduced in another segment of the meeting. But otherwise, I want to invite those folks who are new to us this morning. Please introduce yourself to us. Let us know your name, if you have an affiliation, and what it is that brings you to this group.
I can start. I'm new. My name is Mimi Dahl. I work with Condeo Consulting, and we do a lot of work around health and social service consulting. My interest in this, beyond helping to end the pandemic, would be we do a lot of work around health equity and health behavior change, looking at interventions specifically for health behavior change. We've done work adapting evidence-based interventions from one community to another, or from one format to another, whether that's in person to online. So we had special interest for this topic because of that. So we're happy to be here.
Welcome.
Thank you.
I'm Christy Howarth from VNA Healthcare. I'm very pleased to join you. I've just joined the communications work group and I'm happy to be here. Thank you.
Welcome.
Hi, I'm Lynn LaPlante, and I was just recently elected to the DuPage County Board in District 4. I'm going to be chairing the Community Development Committee and also a member of the Health and Human Services Committee. So I'm very, very interested and invested in your work, and I'm so happy to be here. Thank you so much.
Welcome.
Thank you.
Hi, I'm KG Aiken. I'm a pediatrician. I'm the chair of the pediatrics department at Good Samaritan Hospital and part of the leadership team at the hospital. Nice to meet you all.
Welcome.
Hello, my name is Talia Dominguez from Alivio Medical Center. I'm a community health worker and with my co-worker Alejandra Aguirre.
Hi, my name is Alejandra Aguirre. I work in Alivio Medical Center. Good morning.
Welcome to both of you. Thank you for being with us. All right. Thanks so much for helping us get to know new members on the call. Now I want to invite to the microphone DuPage County Health Department and Chris Hoff regarding testing and vaccine updates.
Yes. Good morning, Dave. Can you hear me okay?
Morning, Chris. Yes.
Okay. Excellent. Good morning, everybody. Thanks for joining us and excited to see so many new faces too. This group continues to grow and it's so much fun to see the diversity of organizations and people that are interested in getting us out and through this COVID-19 pandemic. We have a lot of hope this week in terms of vaccine being available, but it's going to be a long process. So we want to be really excited this week and then recognize that we still have a ways to go and really work together to keep people safe until they have the opportunity to be vaccinated and we can get the community transmission rates back down in more control. So in terms of testing, just an update that we, through the health department, continue to offer 2 drive-through COVID testing sites, one in Wheaton and one in Villa Park. And I will pull up the page here as we talk so that you can see that. And remember to send this link out, be able to share that with folks. Our website is a great place to find out about testing, both through the health department and through other opportunities. We want to make sure that people know that testing is available. Absolutely through our sites. There's no insurance needed, no doctor referral, no residency requirement. And these are valid sites that will get you good results, get them quickly, and get linked then to follow-up services that need to be available. The site in Wheaton, the site in Villa Park are linked here. Also want to recommend using this other test site location link. We've had more reports of test sites that are popping up in the community that may be very valid and legitimate, but we want to make sure that people know where to find good, accurate information. And so we link to the other test site locations through our website. There you can find the Illinois Department of Public Health's map. They are vetting test sites, so anything that you find on the Illinois Department of Public Health test map that's available through this link, it has been vetted by them. So we want to make sure that people are really using test sites that are appropriate, are getting good results, are using an approved test, and really are appropriate for use. So we'd recommend you use those if people have questions or you see a site pop up. Evan, I know you've had one in Bensonville we've been trying to work through and make sure is approved and legitimate. We don't want to assume that sites are not legitimate, but we want to make sure that before we're recommending that people go there, that they're going someplace that is definitely a site that they can trust and count on. So if you have questions, recommend using sites you know about or through official health systems, and then otherwise to use the IDPH test map available through this link to find out if that site's been approved. And then finally, we have been working with communities to bring mobile testing out to communities through the Illinois Department of Public Health. We have 2 coming up in the next week, Sunday, December 20th in Elmhurst, a collaboration between Elmhurst and Bensenville to bring testing to the community, and then Wednesday, December 23rd in Hanover Park. So still have a lot of options. We're seeing a lot less demand for testing. As you know, the Wheaton site was seeing 600 plus people every day and shutting down early. Or we've been seeing about 300 people per day at both sites. So you can definitely get in and out of those sites quickly. Results are coming back within 2 to 3 days, sometimes even faster than that. But really encouraging that if people have symptoms, they get tested, encouraging people who have had contact with somebody who's a known case that they get tested, that they take advantage of these sites while they're here. We do anticipate these sites, at least through the county, being available through the month of January too. So they will continue to be available, and we absolutely want to recommend that people get tested. Even as the vaccine news comes out, there's a lot of hope and excitement about vaccine. We're still in a period of very high disease transmission in our community here in DuPage County. So very important that we continue to wear masks, practice physical distancing, try not to gather in large groups inside, and then to be tested if you have a reason to think that you've either been exposed or you have symptoms that are from COVID. Any questions about testing?
Chris, may I confirm that the site in Bensenville, you had referenced checking in with Evan, is a VNA healthcare site, and we are collaborating with Bensenville and have information on the IDPH resource page and also the DuPage County the health department resource page. So
Chrissy, if I can jump in, no, you're not the site that Chris is referring to. We're very happy. We're very happy with VNA's partnership.
Excellent.
This is a different site that showed up on York Road at Monty's.
Okay, great. Thank you very much. I just wanted to make sure that everybody knew that was a legitimate site.
Yes.
That's great. Thanks for the
people we can to you.
Thank you for the clarification.
Yes, thank you, Chrissy. Sorry to have made that seem like that might have been you. No, we are very happy to have VNA providing testing services in DuPage County, and we appreciate your partnership.
Perfect. Thank you. Thank you so much.
Chris, Jan Geider here. Do we know what percentage of DuPage residents have been tested?
That's a good question. And so the positivity data, the test reports are based on unique tests performed. The case counts, when we report the number of cases, are not duplicated. So if somebody's tested more than once, they're only reported as a case one time if they're positive. But the test numbers themselves are individual tests. Dr. Chug, anything you would add about knowledge on what percentage of people have been tested?
I'm trying to think, not off the top of my head. And again, not that, and I can check to see, I know Illinois Department of Public Health does have a running count, like Chris was referencing, of the total number of tests administered by jurisdiction, but that would include duplication since there are many individuals who have been tested more than once. But that would at least give some estimate. So I can look that up and provide that maybe in the chat. Would that be all right? I think that's the best I've got that I can identify at this time. Great, thanks. Thank you, Janice.
Okay, any other questions? I'm not looking at the chat, Dave. Are there any questions about testing?
I'm not seeing any in there.
Okay. Great, then I can move on to vaccine. So in terms of vaccine, we are thrilled. We are so excited this week. I'm personally very excited. I hope everybody else is. This week is a historic moment in the COVID-19 pandemic response. As you've seen on pretty much every news outlet out there, vaccine did start to ship this week in DuPage County. We received the first allocation to DuPage County. That's 13,650 doses of HOPE. That's initially going to hospitals and healthcare workers in hospital settings who are in that first phase of vaccine delivery. And I'll provide a couple of quick updates on that schedule. But just wanted to share a couple of pictures from the unloading. We received vaccine on Wednesday. We've partnered with DuPage Medical Group to store at ultra low temperatures. These vaccines have to be stored at minus 80 degrees Celsius, which is less than 100 degrees Fahrenheit. It's stored in an ultra low freezer, which allows for it to be used beyond that 5-day period you may have heard about. So we had an unboxing on Wednesday, and then on Thursday morning, we actually delivered vaccine to all of the hospitals in DuPage County. So you can see every one of the hospitals represented there. All of them have started to vaccinate healthcare professionals as of yesterday. And so I think we've had about 20% of the vaccine we've received so far start to be administered in the first day, which is really, really exciting and gives us some hope for getting out of this. Now, very important to know that that vaccine, that 13,000, represents only a small portion of what we're going to need. And I'm going to run through just a couple of slides to give you kind of a picture of what that looks like. So let me pull that up. And Dave, if you can confirm that I'm sharing the right thing.
Vaccine distribution, there it is.
Okay, and you don't see the presenter view?
Nope, all
Okay,
good.
excellent. So all of our communication we'll talk about for vaccine and vaccine systems is really building confidence in the system. We want people to know how this works, understand what to expect if they're going to get vaccinated, have the opportunity to ask questions. So we want to hit this over and over again, that we really want to build confidence in this vaccine so that people know how to make an informed decision about their health, know who to ask if they have questions, and that providers and community organizations know how to answer those questions. Just want to highlight here, I think you all know that in the initial phase of vaccine delivery, we're really talking about healthcare personnel and residents of long-term care facilities who will be up first for vaccination. CDC makes recommendations nationally on who should be vaccinated when vaccine supplies are limited. So we're very focused on healthcare personnel and long-term care facility residents. We do expect some additional information this weekend from CDC's Advisory Committee on Immunization Practices that will help us to prioritize individuals beyond that first group, and that'll be national guidance that can be applied then across the states. So expect to see news this weekend about that. We are receiving the Pfizer vaccine on the left right now. This weekend, we expect to hear more about Moderna's vaccine. It's the second vaccine manufacturer that is being reviewed by FDA. Probably as we speak. Their advisory committee recommended that it be approved yesterday. Now we're waiting for the FDA to make a final decision. And then this weekend, again, we expect the CDC's Advisory Committee on Immunization Practices to make a recommendation on how that vaccine should be used and in what populations. This timeline shows in the blue the first distributions of Pfizer vaccine started this week, the week of the 13th. If FDA does approve the use for the Moderna vaccine, we expect that to start becoming available next week, the week of the 20th. It's a really great Christmas and holiday miracle that we're starting to see these vaccines out in our communities and are very excited about that timing. And we expect to see weekly shipments beyond that. What we do not know, and I wish we had more information ourselves and to share with you, is how much vaccine to expect every week. And the $1 million question really is, when can I be vaccinated? When can my parents be vaccinated? When can my brother, who's a healthcare worker? That timing is really dependent on how much vaccine we have available. And so as we know more about that, we'll be able to tell you and tell more people about where they might fit in that. But at this point, we expect to, one, not get all the vaccine we need immediately. So this will be a long-term process. And two, that we do expect to get shipments every week. So we'll know a little bit more every week about that timeline. This phase 1A in orange is where we're starting, healthcare personnel and long-term care facility residents. In DuPage County, there are about 58,000 people that fit in that group. So you can imagine that 13,000 doses only begins to cover that group. So when you start to look at individuals who might be in this 1B or 1C category or beyond, it's going to take some time to get to those groups. And that's a function of how much vaccine is available and where it's going. So as we have more information, we will absolutely be communicating to you and to everybody about how quickly we think we're going to be able to move through these groups. Included in the healthcare personnel bucket are individuals that work in these settings. So you can see that it's broad and we're going to be working our way through that. We have gotten lots of questions, as I'm sure you have, about, I'm a dentist, I'm a podiatrist, I work at a funeral home, I work with patients in this setting. Our goal is to get through those individuals first, but getting to them requires that we have the vaccine to do that. So it's our expectation that it'll be probably 6 to 8 weeks before we have enough vaccine to do that group and then can move on. Vaccine in the first week went to 50 counties with the highest death rates from COVID-19. So that's how the initial allocation was made. And like I said, as of today, we've received 13,650 doses here in DuPage County. For our work, we are moving forward. Our plan will be to offer drive-through vaccine clinics for individuals in that 1A group who may not be affiliated with health systems or hospitals. It will be a little bit different than H1N1. Instead of having these big clinics where people come into a high school thousands at a time to get vaccinated. So that's why that looks a little bit different. And we also know that the vaccine quantities available are going to be much smaller incrementally. So we won't have the opportunity to vaccinate everybody in a 2-week period at multiple sites throughout the county. And this information continues to develop rapidly. So just really making a note again that this information is not final. The numbers are developing week to week. And so that's what is impinging our ability to say in 3 weeks, you can come to this site and be vaccinated. So as we learn more about that, you'll see a refining of our message about when you can get vaccinated. I want to make a plug for the adverse event reporting. You're hearing some media stories about some thankfully very rare severe reactions to the vaccine. There have been a couple reported. It really speaks to the strength of the reporting system and the monitoring to know about those. And I think we'll know more in the next week or two about how often this might happen, what it looks like. But these are all reported to the CDC or to the FDA and the CDC to really manage and understand what those effects look like. And last, I'll make a plug for communications and updates. We have a website up now. We encourage you to use this, to send this in your communication. We've added, since the last time we all met, an opportunity to sign up for a weekly email about vaccine. So as you're getting questions about when vaccine will be available, this is a great way to get information pushed to you that you can then distribute out or tell people to sign up for. So please take advantage of that. And then I'm going to turn it over to Dr. Chug, who's going to talk a little bit about side effects and what to expect. So Dr. Chug.
Yes, thank you, Chris. And so what we're going to walk through are just a few slides from a PowerPoint that is provided on this. It's part of the CDC communication toolkit for healthcare personnel. And I just want to distinguish that, or make the distinction that this is a toolkit for helping to educate all healthcare personnel. There's a separate deck of slides that's also available for clinicians, which is a little bit more technical, but this one is really good to help familiarize, really, you know, like Chris outlined in that phase 1A, healthcare personnel and long-term care facility residents are the two categories, the two priority groups that are included or that fall under phase 1A. And so we really want to make sure we're building confidence and understanding among healthcare personnel of, you know, of all disciplines. So yeah, Chris, if we can move to slide 6, please. We'll start from there. And we'll share this link, so you're certainly welcome to walk through all the slides, but one more, please. Thank you. So just a quick overview of the one vaccine that is now authorized and is now, very exciting, like Chris said, is now being administered in DuPage County and across the nation. And then Moderna is up for authorization or full authorization, possibly by later today if we're following anything close to the timeline from last week. And then for ACIP, Advisory Committee on Immunization Practices, discussion and vote tomorrow, and then possibly official CDC adoption and kind of official recommendation probably in the day or two following, if all goes well. So by next week, we anticipate having 2 authorized vaccines that are recommended for use. So both of these are recommended in 2 doses. And let's see, sorry if we can.
Sorry, Rashmi.
Sorry.
Okay.
There we go. Thank you. Both require, or both are administered in a 2-dose series. The Pfizer vaccine is given 21 days apart. The Moderna vaccine is given 28 days apart. It is very important that anyone who receives their first dose of, say, the Pfizer dose, they must receive a second dose of the Pfizer vaccine. Similarly for Moderna, it must be, the second dose must be the same, from the same manufacturer as the first dose. And that information is provided at the time of the initial dose administration. They receive a vaccine record card and they're entered into the state immunization registry, iCare. And ideally we'll schedule, and also we'll talk about vSafe, which is a new system that vaccinees are encouraged to sign up for as well. This has been a heavily tested, there's a lot of talk about, the speed of this approval, which is wonderful because in a matter of months, within 9 months, we now have a vaccine that's available to really help. We're hoping that this is the beginning of the end of this pandemic. We know we still have to continue to implement mitigation measures such as universal masking and physical distancing and all for months to come, but at least this is that ray of hope that we've really been eagerly anticipating. The clinical trial data that has occurred across tens of thousands of people between both vaccines does show or does demonstrate that both vaccines are safe and effective at preventing COVID-19. And the immunity, the length or duration of immunity is still unknown, but there will certainly be ongoing studies to assess duration of immunity. Next slide, please. Great, thank you. So this is a breakdown kind of by manufacturer. And so pretty impressive numbers here that, there's been literally a global impact of this, pandemic. And so they were each were able to enroll tens of thousands of individuals. And these were the best kind of studies, double-blinded, controlled. So half of the individuals who didn't know what they were receiving, but half received the vaccine candidate and half received placebo. And there were, several sites across the nation and with good diversity in participation as well as in age distribution among the adult population so far. Next slide, please. Something new about these vaccines are that these are both mRNA vaccines. And while mRNA vaccines are new, these are the first mRNA vaccines, the technology is not new. They've been studied, mRNA vaccines have been studied for over a decade in the context of cancer vaccines. And really the way they work is that they teach ourselves to make a harmless piece of the spike protein, which is that protein, literally the spiky part of the virus that we've seen in so many images where across the surface, that's what gives the virus that crown or corona appearance. And so after that protein piece is made, the cell breaks down the instructions and gets rid of them. So it's not something that lingers in the body. And the immune response is, so it then triggers that immune response and produces antibodies, which confer protection to us all. Very important to recognize that mRNA vaccines do not use the live virus that causes COVID-19. They cannot give someone COVID-19 infection. And they also, this is very important, the mRNA vaccine, vaccine component never penetrates the nucleus of our cells. So this final point is important because there are a lot of rumors and misinformation circulating, and we want to make sure we address those, that mRNA vaccines do not affect or interact with our DNA in any way. Next slide, please. And yes, so this is important. Reactogenicity, or really the anticipated or expected side effects after vaccination, are very helpful to understand, just so it's more it's less alarming if someone is vaccinated and expects to maybe feel a little achy or have a transient fever versus if you're not expecting anything. So just important to be aware that side effects can occur and have been reported. They're mostly mild, and they typically don't last more than 3 days. And they might, in those 3 days being the day of vaccination and the subsequent 2 days, and they're most frequently reported on the second day, meaning the day after vaccination. And the most frequent side effects include fever, headaches, muscle aches, as well as fatigue. And thankfully, no significant safety concerns have been identified in the clinical trials. And again, safety monitoring is continuing, and we'll talk, well, I'll just mention it briefly. As Chris had shared, the VAERS, the Vaccine Adverse Event Reporting System, that's a long-standing vaccine safety monitoring system that we are absolutely promoting and encouraging providers, patients, anyone who learns of or experiences any adverse event to report that. And then that's the mechanism established. You can report online or by phone. And then there's a vSafe system that has been newly established and launched that is specifically for monitoring COVID-19 vaccination. Next slide, please. Is this where we go to the next bunch? Yes, if we could go to slide 16, please. Yeah, I thought this was, I like these slides because I thought they help to walk through some facts versus fiction, just to, increase everyone's awareness so we can help address, just even in conversation or with our colleagues or friends and family. So I touched on this briefly, that COVID-19 mRNA vaccines will not give you COVID-19. We often hear similar myths related to flu vaccine, that, oh, I got my flu vaccine, I got the flu. No, that's not true. The flu vaccine, the injection is inactivated. And if someone did feel ill afterwards, it's either the post-vaccination effect, the side effects of your body mounting an immune response, or maybe incidentally, we're all in a community where, certainly we're in flu season, thankfully not seeing much flu activity yet, but related to flu vaccination, it could be, incidental that they exposed and may have even been incubating, like may have already been exposed and developing infection before they develop symptoms, and then they associate their symptom onset with the flu vaccination. But just want to be clear that similarly with COVID-19 vaccination, it is not a live virus vaccine, and it cannot transmit infection to the vaccinee. So people can experience normal side effects, such as fever after vaccination. But again, these are signs that your body is developing an immune response. So kind of, reassuring, not that not that anyone wants to experience that, but in case, at least to provide some explanation. Excuse me. And then just for awareness, it does take a few weeks to build immunity. Specifically, there's the first dose, and then there's the second dose, for example, for the Pfizer vaccine after 21 days. And then after that second dose, it takes 1 to 2 weeks to develop immunity. So we can consider ourselves protected after 5 weeks from the first dose, assuming that the second dose was received at 21 days. So just to give some idea of, how long will it take for someone to be considered protected. And at this time, there's no recommendation to change interactions in the community, meaning implementation of the safety measures. Everyone still needs to, we have such a high level of disease activity still, and will likely continue for some months until we reach that, minimum threshold to reach herd immunity. So until then, we want to make sure that everyone, even if vaccinated, is participating in those safety measures. So let's see, next slide, please. So this is another one that people are, there's understandably some confusion that, well, now if I get the vaccine, will I test positive? The shorter answer is no. Particularly, you will not test positive, meaning you will not reflect infection, or you will not test positive for current infection. So any diagnostic or screening test, such as PCR testing or antigen testing, would not be positive as a result of vaccination. The one test, the long-term serological or antibody test, is what ideally will turn positive when you develop immunity, which is a reflection of the vaccination, of the protection that you're developing as a result of vaccination. At this time, there's no routine recommendation to be tested for antibodies before or after vaccination. But just so, just for your awareness that, that the antibody test may be positive, and that's desirable after vaccination. But that's an indication of history of infection or excuse me, evidence of immunity. It doesn't reflect current infection. So, so as the top line says there, these COVID-19 mRNA vaccines will not cause you to test positive on viral tests reflecting current infection. That's not the case. So next slide, please. Almost done with these. And this is a fact also that even persons who have had SARS-CoV-2 infection or COVID-19 may still benefit from the vaccination. Because we do know that reinfection occurs, particularly after 90 days. There have been reports after 90 days from the initial infection. So we believe that there might be short-term protection from natural infection, but there is not thought to be any long-term immunity. So so persons who have a history of infection should also be vaccinated against COVID-19. The only deferral at this time is if someone was ill and received monoclonal antibody or convalescent plasma, because they may still have circulating antibodies or higher levels. We don't want that to potentially interfere with their natural immune response to the vaccination. So the recommendation is to defer vaccination for 90 days, till at least 90 days from that treatment administration, but still to be vaccinated eventually. Next slide, please. And this is the final one. Basically, some anticipatory guidance of what anyone can expect, and in this context, healthcare personnel, since that's who we want to really make sure we're reaching in phase 1A, but certainly encouraging people to learn about and understand COVID-19 and also understand when a vaccination would be recommended, particularly if they fall under one of the earlier phases, such as phase 1A is currently underway, and then phase 1B and 1C will be further identified and defined this weekend, as Chris mentioned during the Advisory Committee on Immunization Practices meetings that are occurring Saturday and Sunday. And then when you get vaccinated, you want to make sure you understand and read the fact sheet that you receive, and you'll also receive your vaccination record card, which you want to hold on to and maintain to help inform your 21-day second dose at this time with Pfizer. And then afterwards, you want to make sure you're aware of some side effects and know to expect, understand what is expected and what might be, more severe and what needs to be addressed immediately. You want to enroll in VSafe, which is it's a smartphone based monitoring system. So by enrolling in that, you'll receive alerts and opportunities to report how you're doing at specific intervals after vaccination. And continue using all the measures such as universal masking and physical distancing and good hand hygiene and avoiding in-person gatherings to protect yourself and your family and your community. And with that, just wanted to share that since there have been some reports, even since administration in the United States, fortunately very few, but there have been some reports of severe allergic reactions or anaphylaxis that CDC has already posted. Chris, if you're able to go to that link, there's already posted just in the last couple of days some interim considerations to help address and respond to anaphylaxis in persons who are vaccinated. So it's really just a walkthrough of how any vaccination site can be best prepared, that anyone with a history of allergies can still be vaccinated, but it's a precaution so that instead of the routine 15-minute period of observation, they should be observed for 30 minutes. And that that they should be, again, they're asked to remain there for observation to make sure if they are developing any of these localized or systemic symptoms, such as shortness of breath or, rash or throat tightening or anything like that, that requires an immediate response, then we want to make sure we're able to respond medically and call EMS if they're not already being vaccinated in a hospital setting. So so we're on it, and then of course these are monitored, and so far the very few and rare reactions that have been reported the patients have done well. So all encouraging, and just wanted to make sure that folks are aware that this guidance is available. And with that, I'll turn it back over to Chris and Dave. Thank you.
Dr. Chu, just one question if you have a minute.
Yes.
We had some senior groups that kind of, asking about staging other vaccinations during this time when maybe not knowing when they might be able to get the COVID vaccine. So for example, if they were looking at a shingles or pneumonia vaccine, should there be
good
a amount of
question.
time in between, and how should they look at staging some of those immunizations?
Yes, excellent question. And the recommendation at this time is to not combine the COVID-19 vaccine with any other immunization, and to have at least 14 days before and 14 days after the vaccine. That's the minimum interval between vaccines when you're receiving COVID-19 vaccine.
So thinking about the fact that you need 2 for COVID,
Yes,
they were sort of like,
correct.
should I just wait till I'm done with the second COVID and wait a couple weeks or a month after that?
Yes,
Or
a good
get
point.
it now, get these now.
Oh, I see. Well, it might be a while. We'll know better this weekend, I think by Sunday after ACIP votes, but because at this time, the elderly are anticipated to fall under category 1C, which we could be at least several weeks away. So, if that's the case, then it would probably be good to proceed with any other immunization that they're due for. And then once they are anticipating receiving their COVID-19 vaccine, to make sure that they're not receiving anything the 14 days before. And then I think a good idea to wait until 2 weeks after the second dose to receive any other vaccination.
Thank you. And that includes flu, right?
Correct.
Okay, thank you.
Thank you.
I'm gonna jump back in then, and I want to say a couple of things. Chris, thank you so much. You covered an awful lot of ground really quickly, and it's exciting to see all the good things that are happening. Appreciate that update. And Dr. Chug, you just dropped into our minds an incredible abundance of good information. And I want to take a minute, and as I think this through out loud, Dr. Chug and Mila, I want to ask you to help us think about this. That's a lot of information, and it's coming out to you. You are community leaders. Right now, your instincts are what is the important thing. Is this overwhelming? Is this comforting? Is this building confidence? Does it leave you with a question here or there? This is where we need your leadership instincts to be the greatest value. So right now, this has evoked things in you. And this meeting won't be a place for us to have a robust discussion, but I want to suggest that we do 2 things. First, if it has evoked a question, drop that question into the chat so that we have that to be able to build up a response. And here's how I'm going to suggest you do that. If it's a question about that presentation and vaccine confidence, label your initialize or the subject line your question with a VC heart, vaccine confidence heart. And then we know this is a question about vaccine confidence, and we'll put it on the list of things that we want to develop answers to. So you can do that today in the chat if you've got that immediate question, or if it comes to you as the meeting continues on. And the question I have, Mila and Dr. Chug, is when these questions occur to us in the next few hours, the next few days, what would be the best way for us to raise them back up? So
go ahead. Yeah, I'm sorry. Was that a rhetorical question or?
Here's what I would say. I'm happy to receive those questions and take responsibility for getting answers, but you might have a more precise or another way that you would want to handle that. But the important concept here is we want to be sure that this group is feeding us the input that we need about vaccine confidence.
Rashmi, did you want to say anything else? Otherwise, I just had a couple comments.
Please go ahead.
So Dave, I think it's a great broad way to say we're looking for the feedback, and then we're going to use that feedback to have more conversations with you about, I think, Linda just mentioned, it's great to know it's not a live vaccine, that there isn't live virus there. what can we point out to correct misconceptions, to provide accurate information. And I know Kim Siebert's been working on our messaging and using tested messages to couple with some of these specific concerns or positive notes that you have. So Dave, if I'm answering your question correctly, please if you have them in the chat now, great. If you can send them to me or to this group, if you want broader, consensus on it, that would be good. And then we will turn it around and use it in messaging. And I know some of the folks that were on the communications call earlier this morning had already started looking at their communications plan. So they would want your feedback as well. What do you think, Dave? Anything more there?
I think it sounds really good. So Mila, I know that the entire team there is totally overwhelmed. I'm happy to receive these VC hard questions, but if you would rather, we could direct them to you. And we just need to make sure we got a repository of them so that we respond to them by the next meeting.
Dave, if it's helpful for them to go to you because you have other folks that you're also gathering input from, and that consolidates it all in one spot, I'll take it, but I'm here too, so.
All right, so I'm gonna put my info into the chat then with that subject line VC heart and offer that to folks. And so that's our way of making sure we keep this conversation going.
And Dave, this is Penny. I'm sorry to interrupt, but it would be very helpful if people could utilize that versus the chat as much, because it's very difficult to capture chat in a Zoom meeting after the meeting is over.
I see. All right. So there's the, in the chat right now is the place to direct those questions. Thanks.
One quick thing, and I meant to say this earlier, the health department does have FAQs on the website. And those are updated, Kara had brought that up in the chat, and those are updated pretty regularly and often incorporated into the newsletter. So I think that if you have ideas about how we can get those FAQs out there into church bulletins or newsletters or health messaging that's coming from a mosque or a church or another faith community, NAACP, if you're putting something out, we would like to make those FAQs very shareable. So if you're using them, let us know how it's going. If you're not able to use them and you need them in a different format, that's information we could use as well.
Thanks, Mila.
This is Kara. A comment and a thought. I think about our experience when the ACA launched, and this has become really a dynamic process. But there was a pathway by which community navigators, it continues today, were able to pose questions to experts when they were trying to help support other folks out in the community in getting credible information or sort of responding to a particular, maybe arcane need. And I just wonder if we want to spend a little bit of time offline thinking about whether there might be a similar model, whereby as we talk about health ambassadors, as we talk about all of the different pathways we're going to use to try to build confidence and respond to questions and concerns in the community, we have an easy and streamlined way to bubble up those questions and concerns and get expert feedback in a timely manner.
Good, very good. All right. So let us move on to the next part of our agenda. The first part of the next part is actually a follow-up to Chris's report about vaccine arrival in the community. I want to invite Nicole Edmonds of Advocate Aurora to share with us what's been the impact of vaccine arrival in their system. Do you have some feedback for us?
Yeah, thanks, Dave. So I think, as everyone knows on this call, it's been a really tough year for frontline workers during this pandemic, especially those working directly with COVID patients. And so I oversee the community health department for 3 of our sites in central Chicagoland, Lutheran General Hospital, Masonic, and also Good Sam. And I've been on leadership calls for all of those end of the year, leadership calls for all of those sites. ended actually all the calls, on all of those calls, the presidents and the executive leadership team, literally, they were crying and thanking their staff and team members for all the hard work. And they are extremely grateful. The nurses, the executive leadership, presidents are extremely grateful and very excited for this vaccine. And so, I don't know, some of you in the call may know this, but Advocate Aurora Health has basically developed a prioritization grid for our frontline team members. And so first priority really goes to those frontline team members who work directly with COVID patients. And so they got an email, the Illinois side got an email, I think, earlier in the week, inviting them to make an appointment for their COVID vaccination. It is not mandatory at this time, but it's highly encouraged, obviously. And we're also, Advocate Aurora Health is also compensating team members if they have to travel to get the vaccine or if they have to take off of work to get the vaccine, they'll compensate them for their time just to kind of encourage them even greater to get that vaccine. So appointments have been made. Vaccines actually have been administered. I think it started Wednesday or Thursday of this week. They started administering vaccines to team members, and that's including Good Sam in Illinois. Wisconsin actually started last week doing this. They received the vaccines a little bit earlier. But yeah, Dave, just to kind of put a short answer to your question, they are extremely grateful. This was a very trying year for them. They put in a lot of work, effort. They sacrificed a lot personally, professionally. They've been sacrificing a lot. So, I mean, this is like a perfect time, right? Right around kind of the Christmas holidays to get a vaccine. I'm sure this will cover, you know, all of the gifts that they could have received and will receive. I'm sure they'll be most grateful for the vaccine. So thank you to DuPage County Health Department for coordinating with the hospital and delivering those. They're extremely grateful. And I can actually share some pictures too. You know, they took pictures Wednesday and Thursday and today. So yeah, just to kind of sum up, I don't want to go on and on, but they're very, 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 very grateful for the gifts that they received.
Thank you, Nicole. That's my gift for today. That's fantastic news. It's very good to hear that optimism and good response. Now we want to continue this conversation, move into vaccine confidence. And the way that we're going to approach this discussion is twofold. We're going to share some thoughts and ideas about models that have worked well for community connection in DuPage. We're going to invite our colleagues who are doing a community health worker project across the border in West Cook to share with us what their embedded community health workers are thinking now about how they will promote vaccine confidence. And I want to invite Mimi Dahl, to give us a quick overview of a concept that worked well with HIV management. So all of this is going to help lead us toward provoking a discussion with this group about the idea of ambassadors to promote a healthy vaccine uptake in DuPage. So I think the way that we will want to approach this is that I might ask our friends from the community health worker pilot, and I might invite Angela Eastland to the microphone. Angela, you have a number of colleagues who are doing the work with us today in the call. I wonder if you could help guide us through that, give us a picture of how this is going for you. You have a team of folks who now have had a couple of years of building relationships in the community. There's a level of trust that's been established. So now how are you thinking about vaccine confidence with those workers?
Yeah, thank you, David, for inviting us to join this call today. We're excited to hear this information. It's really helpful. I mean, all of the information that the health department just shared is something that I'll be sharing with our team of community health workers from 5 organizations across the western suburbs. We have 12 community health workers in total, and we've really been, this has been a learning process for us as well. We have a learning collaborative model where we meet every other month as a group to discuss, challenges and resources and share those among the group and that really allowed us, that established model allowed us to come together and really respond to the pandemic together as well, because as we know, it's no one can exist in a silo. We all have to work together to combat this virus. And so in terms of vaccine messaging and distribution, all the organizations we met recently for Learning Collaborative earlier this December, and we talked that our primary message is that, we aren't pushing the vaccine on anyone. We're not providers as community health workers. We are trusted messengers of information. So first and foremost, we don't want to be giving medical advice to anyone. We just want to be giving out the facts, and the information from the health departments and the CDC is exactly what we need in order to be doing that effectively. I'll have one of our CHW supervisors give her example of their model and how they're using past experiences to plan for vaccine information distribution. But really, we just want to be myth busters. We want to, give the best and most updated information as we can. So we'll be communicating as a group, as often as possible when we get new information. So all of these FAQs are really helpful, and I will encourage our community health workers to reach out and talk about how those resources are working in the community and what they could use as additional resources. So with that, I'll just pass it on to Allison, our supervisor from Aging Care Connections, and she'll talk a little bit about their experience so far.
Thanks, Angela, and thanks for having me here today. I feel at the end of this, I'll probably get much more out of joining your conversation and hearing what you're sharing with the folks in DuPage than I'll be providing for you. As Angela said, I'm Allison. I'm with Aging Care Connections. We are a nonprofit in the western suburbs in Cook County, providing services for older adults. And I think it's similar to many of the care coordination units and social service agencies that you have in DuPage, providing care coordination, caregiver support, home delivered meals, et cetera. So we have been part of the pilot for the community health workers. Our goal is to share information in the community to help increase access to healthcare and increase access to resources that can support older adults, their families, and their caregivers in aging well. For this program itself, for the vaccine communication, we intend to use a similar model to that we use in increasing information and participation in the 2020 general election and the 2020 census. So we're going to use that same model and adjust it. I don't think, based on what I'm seeing in the chat and what I'm hearing in your discussion, I don't think anything I'm going to share with you is going to be things that you haven't already considered, but I will just go ahead and share what we plan to do. So our goal is to, obviously, as we've already said, dispel myths, increase confidence, and increase knowledge of the facts surrounding vaccines and how to access them, and to encourage community members to make a plan. That's our biggest message. Make a plan to talk to your doctor about the vaccine, and or make a plan to get the vaccine, or at least to find out the facts for what is best for you and your own health. And that was our big message as well for the general election and for the census. And obviously to provide information about timing on the vaccines and locations to access it. We intend to use multiple methods of communication, verbal, paper, social media, also, and one-on-one, all different types of methods of communication, because as we all know, every person processes information differently. There's a high level of stress and anxiety regarding COVID, given everything that has been happening as a result of this pandemic and the impact on people and their personal lives. We know that in general, there's just a lot of information to absorb, and people will need to absorb it piece by piece over time. So as a result of all of that, we will use many different methods of communication. We will do continuous pieces of information over time shared, and again, hoping that people can absorb what we're sharing with them. So some of our communications will include informational flyers that we'll obviously be sharing with our clients, with our partners, with our networks. Just exactly as Dr. Chow mentioned, talking points for our staff, for our board members, again, for our partners in the community, just helping folks, anyone that can assist in dispelling myths, increasing confidence, increasing the sharing of facts. So really getting those talking points out to a wide audience. We'll be having one-on-one conversations with clients, overviews at all of our support group meetings, all of our virtual programs. We have virtual classes and exercise classes and social programs happening pretty much every day of the week. So we'll be sharing it at all of those. we'll be having one or two presentations specifically about the vaccine, and we'll be relying on subject matter experts to provide those for us. We don't have timing for them, but I can certainly share that information back with Dave when we have them scheduled in the future. And if you want to then share those links with anyone in your networks, they're welcome to join us for those. And obviously sharing links to credible information so folks can do more research on their own beyond what we're sharing with them. And that's kind of the template that we will be following for spreading information about the vaccine. Thanks, Dave.
Quick question, Allison and or Angela, what demographic other than aging are you covering?
That's a great question.
I'll take that, Janice, because for the overall community health worker program that Angela talked about, it's my agency that's specifically supporting older adults. The other 4 agencies are supporting folks of all ages. So for me, we support older adults age 60 and above. However, many of our clients are caregivers or family members as well. So when we provide information, although the bulk of the folks will be 60 and above, and probably with that, probably 75 and above is more of our average age for people who will are direct clients of ours. We will be sharing with people of all ages through our networks.
Angela, can you give me more feedback on race and ethnicity, please?
Great, yeah, for sure. We have a variety of service populations, so I'll speak more broadly, but we have seen a growth in the Latinx populations in our service areas, and so that is definitely a focus of a few of our organizations. In terms of their service population, we have organizations that serve the undocumented and mixed status families. So that's been an added challenge during this pandemic for accessing resources and things like that. So I can get you our specific demographic reach, more numbers and things like that offline if you'd like to.
Angela, I wonder if it would get to Jan's question. I see that we have some community health workers and supervisors also on the call in the meeting. I wonder if they might share with us a snapshot of their experience in vaccine confidence promotion. Could you help guide us through?
Good morning. My name is Dawn Robertson. I'm from Healthcare Alternative Systems. And at this time, we are not going out in the community because a lot of the organizations are closed due to COVID. So we have not been able to inform the community about the vaccines. We haven't received calls at this time, but as soon as we receive them, we will definitely direct them to the county health departments, the hospitals, and things of that nature.
Dawn, thanks so much. That's a picture of how it's feeling right now in relating to your patients in the community. Are there other folks from the pilot on with a similar snapshot?
Yeah, I think we do have a few more of our community health workers. Maybe Alejandra or Talia. Do you want to unmute?
Yeah, so I'm Talia. So we've been, as other members of pilot, we have been not going out in the community because of COVID. But for Alivio Medical Center, we've been calling patients that have been going tested for negative results for COVID. And we'll be giving them education on how to prevent COVID. For now, as Angela mentioned before, we are not recommending like, oh, you have to get the vaccines or no. I mean, it's their decisions. And from my experience, I have told them that they should talk to their provider to be more work, because I don't want my response to influence them because it's their own decision. But I mean, it's basically they just want to know more facts about it. They want to know if it has secondary effects and how long does it last. And there's just a lot of questions that I've been seeing from patients that I have been calling.
Thank you, Talia. That's a really helpful view.
Angela, Jan Guided here again. Do you have any kind of numbers for how many undocumented people in your community? And is there a plan to reach out to try to reach this group?
That's a great question. So I don't have specific numbers off the top of my head, but I know our organizations like Mujeres Latinas en Acción, they have more information on that, so I can get that to you. But in terms of reaching out to them, we've done a lot of shifting, obviously, to virtual outreach within each of the organizations, and they've had really fabulous success at both at Alivio Medical Center and at Mujeres in getting a broader reach of their video, like putting out health education videos over the pandemic and really getting lots of views on those, lots of shares. So we're going to continue to do that kind of outreach and be able to reach people through social media, try to break through some of those barriers of misinformation and get some good information out there. But in terms of other outreach possibilities, we're still kind of exploring what that'll look like. Maybe some hybrid models of, safe physical distancing events in the future this spring when there's a little bit more knowledge about, where the vaccine sites you can go to are, or how to talk to your pharmacist and your physician about getting the vaccine. So we'll have lots more lessons learned, I'm sure, over the spring in terms of outreach to specific populations and what's working and what methods are useful. So I'm sure we'll have more information for you in the coming months.
I don't mean to hog this, David, but what are we doing here in DuPage County? I mean, I just happened to read an article on this last night. That's why it's ringing in my head. What are we doing here in DuPage County to reach out to our undocumented people?
So Jan, that's the key strategy question. And our goal this morning is to get that discussion going, raise up those things that are going on. So my thinking here is I want to express incredible gratitude. Angela and Allison and Dawn, Ale and Talia, thank you for this incredible snapshot of how this is working for you. What's it feeling like right now? I'm going to suggest that we now move to what's our experience in DuPage County with community outreach. And I want to invite Kara to talk about our history with patient navigation. And then we'll check in with Mimi about the some other successful work that's been done. And then we're going to open it up. Well, excuse me, before we do that, we'll hear from the communications committee and then we'll open it up. Jan, to go right at your strategy question.
I'll speak briefly. I think that David asked me to talk a little bit because the DuPage Health Coalition, which coordinates health access for low-income uninsured residents of DuPage County, many of whom are undocumented, Jan. So that's a big piece of the work that we do and certainly central to our mission. For about 7 years, until about 5 years ago, we had a team of 7 community health workers, lay navigators, that were working on messaging, advocacy, outreach, and support in partnership with DuPage County around specifically women's health issues to a predominantly Latinx population. And so I think there are certainly some lessons that can come from that. And I think that the work that Angela and Allison and others are doing in the suburban cook population is also a really helpful adjunct. And so we're looking to learn from you and figure out what would be most effective. It occurs to me that there are the rubber meeting the road here is that the reality is there are many effective strategies that we could be employing. And what this group is really being tasked with is sifting through all of the choices and deciding where we think we would have most impact. I think that the idea of reaching out into the community, looking for lay navigators, promotores de salud, or others who had an active interest and engagement, who are already well connected to the community and who might be positioned to be liaisons and sharers of credible information. That is one of the strategies that I hope we give some real consideration to. I think that as we talk more about the work that the communications group has been doing and some of the messaging and some of the data that we're hearing, we'll learn that no one strategy is going to be adequate. And in fact, maybe turning over to some of the others so that we make sure we have some time to talk about the work that's been happening at communications, because I think that that has some roots and some germinating principles that we want to make sure we can explore.
Mhm.
Oh, Kara, thanks so much. I want to invite Mimi, if you would, could you give us a thumbnail sketch of the popular opinion leader intervention? That's a style of ambassadorship that has some good evidence behind it.
Yeah, absolutely. And I think this piggybacks really well with what Kara was just discussing in terms of kind of reaching into the community and identifying some trusted sources. So the popular opinion leader intervention comes out of the HIV prevention world. And the gist of it really is to identify trusted, well-liked, what they call key opinion leaders within specific communities, people that are trusted sources, that information from these sources will resonate with our audience, with the thinking that when you're getting information from a source that is trusted and well-liked, it's more persuasive and more believable. So within this model, these individuals would be trained within everyday conversations, how to deliver that message, how to persuade folks, how to allay fears, because we know there's a lot more than just factual information that goes into your health behavior and the choices that you make. It's your peer norms, it's your community norms, it's your values. There's so much more that goes into it. So this really does address some of those concerns. I think we could also use a model like this to get at some of what Jan was talking about, looking within specific communities, looking within the undocumented community, addressing some of those maybe fears and concerns about, you know, if I go to get a vaccine, does that out me as undocumented? And maybe I won't go then. And that could be applied to a range of sub-communities and fears and concerns that folks might have, you know, language access, you know, Asma brought up, are vaccines halal? You know, is it okay within the Muslim community for people to take a vaccine? So that's really the gist of it, is identifying within communities who are those trusted sources to deliver those messages and train them well to do it. I'm happy to share out more information about popular opinion leader if that's something that folks are interested in. And I will say also, just to give a plug, that this model is already being translated from HIV prevention work to COVID work. There's some research being done right in Milwaukee where they're doing this exact thing. And, you know, in keeping with social distancing, they're doing a lot of it over social media. So there's some precedent already for this work being done.
Thanks, Mimi.
Yeah.
Appreciate that so much. So what we've heard now is a picture of what's it looking like now, reaching out to populations regarding building confidence. And we've heard what's our experience in doing this kind of ambassadorship work in DuPage. And we've heard from Mimi about some evidence-based practices that contribute well. Now we have a communications committee that's had a couple of meetings and is thinking concretely about the ambassadorship idea and has some takeaways that come from that. And I want to invite Mila, if you would share that group's work.
Yes, thank you, Dave. This morning when we had a chance to meet just before this meeting, a number of us were on that meeting and talked specifically about a couple of key messages and strategies that we wanted to get into so that we could talk with all of you. And I think we talked about testing, we talked about PPE again and the need to get mask kits out there. Kim Siebert's going to send an updated request form to all of us so that we can make sure that we get those mask kits out there and keep the positive messaging out there on the masking. But we spent a lot of time talking about health champions or ambassadors and how to reestablish our connections with the complete counts committees and looking at some of the local counts committees, to see, are there faith leaders? Are there, Mimi, I'm going to try and mimic your language. Are there popular folks within the communities that we can get to that are not our usual partners? So we're going to have a deeper conversation about how many of our municipalities have a counts committee and if they have a strategy to continue communication with them, because we'd like to get the mask kit request forms to those counts committee folks right away. And then we want to start engaging them in conversations about health champions or ambassadors. So we talked about faith leaders in many of our cultural subgroups being great opportunities to share messaging. And we also talked about chambers of commerce. So the Hispanic Chamber of Commerce getting to our essential workers. And Kara, to probably some degree, we would reach the undocumented folks that way too. And then maybe looking to some other partners like, you know, a paramedic or a fire chief or somebody within another organization, whether it's a cultural club. I mean, looking at Mimi's approach, it really could be anybody. It could be, you know, a soccer coach. It could be anybody. So we need to think broadly about that. And then Kim Siebert shared the idea, and this is getting closer to when vaccine is available to the community, of having PSAs done, some public service videos and things like that done of those health champions sharing that message, and potentially using some consistent messaging that Chrissy at VNA had spoken about, that VNA is doing. And Chrissy, can I just ask you to share that you're using, you're repurposing your flu messaging and building on that. Do you mind jumping in and talking about your timeline for that and how you're going to be using your healthcare providers?
Yes, happy to. Thank you. We had done a flu vaccination campaign, social media campaign with some of our providers, but also community health workers and community leaders. We had the mayor of Elgin and the mayor of Aurora participate. Other individuals like parent liaisons from the school, the Spark, which is the kindergarten readiness program that United Way runs. They participated. The food pantry program and leadership participated. So just a broad range of individuals within our community that are ambassadors and work with their population and the shared population that is also covered by VNA, that's served by VNA. And we are pushing out the messaging through our social media, but also requesting and that they are sharing it through their social media as well. So our plan is in the spring, when we are preparing for vaccination, to be also able to share that. I was delighted to share yesterday one of our pediatricians getting the vaccine. She works within the hospital as well as within the clinic. And so just starting to sort of build the confidence of people seeing that we are all getting that vaccine ourselves, and that we are encouraging them to as well.
Thank you, Chrissy. And I wanted to bring up two other points that go along with the messaging, that some examples that Chrissy just shared. One of them is that Kim Siebert had talked about our Chicago area counties and Chicago itself using messaging that references protect yourself, protect your family, protect DuPage, or protect Chicago, or protect Lake or Will, or whichever county. She had talked about that messaging being tested and utilized broadly for a consistent message. So we're going to learn more about that strategy the next time we meet. And the other group that we talked a little bit about was seniors, and making sure that we're reaching seniors, not just those that are at home and not a part of long-term care facilities, but also those that may be connected to a cultural group or a church or a mosque or a synagogue, and might get information from trusted faith leaders. So that is a short summary of our meeting. We got into a lot more detail than that, and Dave was able to join us, and a number of you folks were also were on. Nicole Edmonds was there. We had a nice group. So please add whatever I may have missed.
Neela, I'll just add one comment that we actually didn't get a chance to talk about at that meeting, but that a number of us heard from our hospital partners around this morning that I thought was a a novel application and also one that we wanted to be mindful of. In general, amongst our healthcare community, the reports that we're getting are that vaccine confidence is fairly high. There's a lot of enthusiasm at our hospitals and amongst our healthcare partners around getting vaccines. But there's concerns that vaccine hesitance may be higher in some of our long-term care facilities. And this is especially a vulnerable population, both in regards to the patients of those long-term care facilities, but also in terms of the frontline workers that are keeping those individuals safe. And so a number of the medical directors of the long-term care facilities were getting their vaccine yesterday, and were filming it so that they could bring it back and share it with all of the members of their team to try to allay fears and instill some confidence, hoping that they would get similar rates of uptake, not just amongst the clinical personnel of the long-term care facility, but all of those frontline workers that were also both vulnerable and vulnerable to potentially being a source for the transmission of infection.
Thank you, Kara.
Thanks, Kara, and thanks, Mila. So here's what I'm thinking. We have 8 minutes remaining in our meeting. I want to be sure to have people pay attention to the chat. Particularly, this is an opportunity for us to bring a reminder that safety kits, including masks, are still available through the DuPage County Health Department. If you're doing events, distributions, and your constituents could use those, there's a link there for how you could still get those in your possession and distribute. I want to suggest that we have had a lot of information come to us regarding building vaccine confidence. And there are 2 things I want to do in our remaining 8 minutes, if we can do this. The first is to make sure that we take the temperature from you. I want to ask you, particularly those of you who have constituents, what do you think about this notion of ambassadors and building trust for vaccine confidence that way? How does that feel inside your system? I'm looking at a number of you who have membership constituents. What do you think about that idea with your group, your association, your church? So we're going to want to address that. And then at the same time, I'm going to layer a second question. Jan has raised the question, what are we doing regarding reaching those folks in the community who are undocumented? So as you're thinking about how this resonates in your constituency, your association, could you add that part in? What's the role or the place for undocumented folks in your system? Are you a place where that kind of outreach could have legs and impact? So that's what I'd like to open up and ask for some input. Thanks. And I'll prod a little bit. I'm looking at Asma and Michael and Reverend Miguel. I'm looking at who else here has kind of constituencies. Linda Young, you're with us as well.
Yeah, good morning. I'm Reverend Miguel from San Marcos Episcopal Church in Glen Allen. As you know, we got a Latinx community in San Marcos, and this church is one multicultural community. With this means that we are really concerned about everyone in the communities, and especially with the Latinos because Hispanics, because we understand that there are many needs, especially in this time, and we are finding through the conversation with the people more needs that and more concerns, especially. So what we're doing is like be active, participate like in these kind of groups that can we engage, and bring all these inputs and sharing all this information that we needed, because it's a lot of information that we need in our communities. Unfortunately, especially during this time, the Latino community or people with no documents, they are really hurt and they are afraid, a lot afraid, and everywhere you go, So even if there's a good news to hear that we got a new vaccine, there's concerns to come into this community already. That what's happening with the Latinos, because we hear even in the news that they say this vaccine is just for the citizens, a language that means it's a strong message, the way we perceive, which they show lot of sensitive, you know. So we need to understand that this part, that how important is, how can we communicate this? How can we reach, especially target this community and his concerns and his need, and I think I'm glad to hear this conversation that you have. And this is what we are here building, you know, create this and learning, because this is it's a lot of process, you know, a lot of learning to maybe we're gonna find more questions, you know. One question I get this week, you know, that why the Latinos, they respond this way or different way to the other communities, you know, because the Latino community or Latinx community, they're so diverse too, you know. So we need to learn to understand each people from different countries. They have different concerns and I mean customs, you know. Even during this time, we celebrate the religious activities, the posadas. You know, how can we celebrate the posadas? Because posadas now integrate not only for Mexican people, they are for more people. How did this happen? You know, no, and that we are enriching all these customs. So this is just an example that what happened, and especially when we addressing this this topic, you know, and giving an idea that yeah, it's good to have a lot of information in Spanish, but also how can we get in make sure that people getting this information with trust, especially with trust, you know.
Good.
So this is what we have to work in. Thank you.
Bye. Thank you. Thanks.
What I think should happen, and I know that we're not strong in this area, is to partner more with our Latin brothers and sisters out there. I know one of our missions is to become much more diverse, which we are. I think our organization is extremely diverse, but we are missing a big population in the Latin community for our membership. So I think that we probably should be reaching out and partnering with the Hispanic groups so that we can move forward. I know that it's one of the goals of, again, our excellent health chair, Janice, is to reach out to that undocumented areas of the community and also to partner with them. And, you know, we're not saying that you have to be a member, but partnership and collaboration is always going to be a big key to getting the word out.
Thank you.
Okay, this is Linda Yang, and I just want to let you know, say that we have a public health program, you know, already, you know, it's been working with the DuPage County for a long time, and also the other counties. So we're going to continue to use our regular network. You know, we have outreach, we have a promotion program for all different kind of disease in the past. So we're going to utilize that network. In terms of the, you know, undocumented, we have been, since this pandemic, we have had funding to work with undocumented population to distribute, you know, rental assistance, you know, job trainings or whatever, you know, and education for, you know, COVID-19. So we have some, you know, we have we have a list of the undocumented people that are coming out because of the benefits, so we can go through those lists and you know, talk to them, you know, so that's our resource. I think, you know, okay, and also we had the census program. We were really working with undocumented also, so we can utilize those network we had in the past. I think, you know, the good thing is I found, you know, even they are afraid, but, you know, if you say something, they can get the benefit, you know, like monetary support, assistance, or health. I think they're willing to coming out. So that's my thinking. So we're going to continue to work with them. Yeah.
Thank you, Linda. Thank you. Asma?
Yeah, if I can chime in, I'm Asma from ICNA Relief, which is the Islamic Circle of North America. And I've been listening and taking a lot of notes and getting all this information together from the meetings that I've been. Thank you for inviting us. And I just want to, I'm taking notes, and I'm going to share all these notes with you about our questions and concerns from the Muslim community. And I want to first start that although we have food pantries and we serve low-income communities, our outreach expands beyond that because we have partnerships with masjids, which is the Muslim places of worship. So our outreach is very diverse, demographics and income levels. So we have that potential to reach more people. But one thing that I do want to clarify for a minute is that you should never lump all Muslims under one category as just, okay, this is the Muslim community, because the Muslim community is very diverse. We have Latinos, we have Blacks, we have Arabs, we have Asian, South Asian, East Asian, European. So I just want you guys to keep that in mind, that when you say Muslims, you have to understand that it's a very diverse demographic of high income, middle income, low income, and lots of, everything in between. So you have to be mindful that when you say I'm reaching out to the Muslim community, you have to specify which Muslim community, because a lot of, for example, Arabs will be going to a certain place of worship and they'll be influenced from that place of worship. You have the Black community where they go to their places of worship. That's just the way, like where they feel comfortable of going. So you have to be mindful of the language that you use, of the outreach that you use for that. And also as trusted messengers, I like that term, trusted messengers, we have to be confident ourselves in the vaccine. So we have to, the leaders, us who are giving this message, and people are trusting us to listen to us and say, okay, ICNA Relief said this is a trusted vaccine, this is a safe vaccine. We have to be confident in it. And meetings like this and PowerPoints, it builds our confidence and makes us understand it better.
We lost your audio, Asma. We've lost your audio.
Just the last 5 seconds or so.
Yeah, just the last little bit. You noted that these meetings are building confidence, and it was at that point that we lost you.
Yeah, sorry.
There you are, good.
Somebody got to there. But I will share all this. I don't want to take too much of your time. There's a lot of concerns that I have, and I will share all this email with you. But the main thing is that I wanted to clarify about Muslims. When you talk about Muslims, that you have to reach out to, the individual masjid, the individual place of worship. And there are many in DuPage County, and in Illinois, there are a lot more, obviously, but in DuPage County, there are. So that's it. I also like the idea, finally, just to say that it needs to be multilingual, and video presentation is great, and pictures really, send the message, because I think someone mentioned like people have a 17-second window, that we have to reach them. So we have to reach them in a very simple, but yet sophisticated way of not like dumbing it down for them, like assuming they don't understand, they're uneducated, because that's not the truth. Even if they are low income, they might be refugees from other countries where they were professionals in their country, where they were doctors or they were lawyers. So we shouldn't dumb it down for them, assuming that, oh, these are low income people, so they don't understand. Let's, make the language very simple. They might actually understand better than you or I. So those are just like some assumptions and misconceptions that I hope that just to clarify. And thank you for having us.
Asma, I want to say I can certainly identify with what you're saying, but I like to ask a question as well. What do you recommend, or how do you recommend we address the community?
The community, the Muslim community, they're very strong in their faith, and they have a lot of confidence in their faith leaders. So I think if you combine the trusted healthcare professionals with the trusted religious leaders, that's an unbeatable thing to have, because they will take, the healthcare leader is talking from the healthcare perspective, And then the religious and cultural leader is talking from the way of life, because as Muslims, we live like Islam is like our way of life. So it's not like something we just go pray in the mosque, then come home and we're done. It's like everything in our life revolves around our religion. So if you have the trusted faith leader telling people and telling the community, yes, this is what we must do. This is part of our religion to take care of the community, take care of our health, then I'm confident that people will. But like I said from the beginning, we have to be confident in the vaccine, that it's safe, that because, as an American history, we have this, dark legacy of using Black people and minorities as guinea pigs, as testing subjects. So we want to make sure that the vaccine is safe, and we're not assuming these are low-income people, so they're disposable. If the vaccine doesn't work, if something goes wrong, it's okay. They're low incomes or they're undocumented people, which is not true. We have to have a value of life for everyone. So as long as we convey that message that your life is valuable, look at these rich white people are getting it, these healthcare professionals are getting it, and we're inviting you because we care about you. That's why we want you to get it. That's the message that they should be receiving, that we should all be receiving, regardless of, our background. We should all be receiving this message that the reason we're giving you this vaccine is because we care about the health of this nation, the health of the world. So everybody is getting it. It's not just we're pushing it on you. Let's see if it works on you. Then we'll move on to, other races.
Oh my, so well said. Asma, that's if it's all right, I think that may be our way to close the meeting today. We're at 11:07. We're 7 minutes past our ending time. So I want to bring us to closure. Before I do, I want to make sure with Kara and Mila that there's not an announcement or an update that needs to be given live here before we close. And Jan, I want to ask you that question also. My intention on the mental health update is to write up a summary and distribute it after this meeting, and especially to draw people's attention to DuPage County's new suicide prevention initiative and making sure that we're inclusive about the way we build leadership around that. Kara and Mila, anything else that should be noted today?
I think we need to talk about our next meeting, so probably so people can anticipate that. But absent that, I think we shared some of the communication updates, and thankfully through other venues, a good bit of the information about PPE is being distributed as well.
Dave, Karen and I can put together a summary of the PPE and other items that are being dispersed right now. So you can get that in an email update. Thank you.
Okay, very good.
And David, if I can just give
yes.
10 seconds, and let's just remember, especially as we are going through the holidays, because this is going to be a very difficult holiday for a lot of people. So let's just remember to ask those we love, and maybe even those we don't necessarily love, but okay, are you okay? And then be mindful of resources that we can refer them to if they say, I'm not okay. Okay, thank you.
And I want to tag on to that, Jan, that we're going to include a list of what those resources are here. There are specific points of connection that came up in our mental health subcommittee that it's really important for all of us to be aware of so that we can link people to those. Today, what a great amount we accomplished. Although it was very brief in these last few minutes, we got some fantastic input all across our team. We have some great information now about the vaccine, and I can hear from the responses coming that with our group, confidence is growing and our ability to talk about that confidence is growing. So I want to close with an incredible thank you to all of you for the investment that you've made in this promotion of good health in our community and your hard work to ensure that optimal health comes to everyone in the community and no one is disadvantaged. We do have to think about another meeting, and I wonder, so we don't have a date out there, right? So I'm wondering how the first Friday of January would be for folks for us to come back together again.
Dave, you're thinking the 8th, maybe?
Yeah, not the first.
Not the first?
First Friday.
Second is good.
I'm sorry, the second Friday. Thank you very much. The first non-holiday Friday.
The 8th is fine. I would say wait from the 22nd. I don't know how others are.
We could also, we've been going at this very intensely. We could go another week there. There are holidays coming here. We could look at the 15th. How's the 15th?
I like
Dave,
the
we have
15th.
the Impact Steering Committee, Impact Your Page Steering Committee on the 15th. So that will affect some of the people in this group.
So 8 might be our best. And I wonder, we did this in the morning. I like that. That's a better way for me. How about, is morning of the 8th a good time? I see nods. That's where we'll go then. Well, so here we are. We're at the end. Thank you all so much. I'm wishing you safety. I'm wishing you the great relief and refreshment that the holidays can bring. Appreciate all of your participation, and we're adjourned.
Thank you all.
Thank you, everybody.